second panel member is Paul Talbot. He's a very proud young Gamilaroi man who's ultra keen to get up on the stage. He's getting more and more exposure. He's one of our young leaders that we're nurturing and encouraging to come through. He's from the small community of Boggabilla, which is in the northern central tablelands on the Queensland border, Queensland-New South Wales border. And over many years, there's been various things said about Boggabilla and particularly around the lack of services that are being provided to that very small community. He started his career in health way back in 2012 as an unqualified dental assistant in oral health. But since then, he's gotten all of his qualifications in dental assisting through the Poche Centre for Indigenous Health, our scholarship program in Uni New South Wales, Uni of Sydney in New South Wales. Got to get that right. He's done a Cert 3 in dental assisting, Cert 4 in dental assisting oral health promotion, a Cert 4 in dental radiography, and a diploma in dental technology. He's a qualified dental technician and has also done some research work and research skill sets as well. His diploma in dental technology qualifications allows him to go out into rural communities in New South Wales to provide a free denture clinic for communities, especially those communities, and started off where he comes from in Boggabilla. And he's able to do that because through Kay's and Greg's contribution, we have I think it's the only dental technicians van in Australia. So we have the dentist going out and they pull them, and then Paul comes in and refits them with teeth. So we do the whole service. But it's a very important one because, well, maybe Paul, you're going to talk about how long it takes and all that sort of stuff? Yeah, I won't jump into steal your thunder. So after finishing all of his qualifications, he managed to obtain a full-time job with the Poche Centre in Sydney, and he's become a mentor for young Aboriginal students who are also coming through in the dental assisting scholarship program. Paul's also received a number of awards in recognition for his fantastic achievements as a young man. But oral health is one of our big challenges for Aboriginal and Torres Strait Islander people, and I guess Paul will touch on that because his focus is going to be on oral health. So Paul, welcome.
My name's Paul Talbot. I'm from Boggabilla, which is on the border, New South Wales border, Queensland border. I also work with the Poche Centre of Sydney, and I'm here to share my journey with you guys. It's not as long as Nikki's, but it's my first time, so bear with me. First of all, I'd like to acknowledge the Ngunnawal people as well, and everyone in this room today that's joining us on the Ngunnawal country. I'd like to pay my respects to elders past, present and emerging as well. So about me, my name is really Folau Talbot, so my dad is Tongan and my mother's Aboriginal. I grew up also known as Paul. I currently live in Sydney now and work with the Poche Centre, the wonderful team at Sydney. I have 2 brothers, 6 sisters, so a big family. My community. So I did all my schooling at Boggabilla. I dropped out of year 10 and then decided I needed to make something of myself, so I went back and did year 11 and 12. I'm a young Gamilaroi man and proud of it. So I first got introduced into health back in 2012. After I finished school, I got a job at the school in the administration office. One of the teachers there approached me and said to me, there's a job going as a dental assistant, this would be a good way for you to step into the health business. I was like, yeah, all right. Didn't know what I was getting myself into. I was like, yeah, because they couldn't reassure me if my job was safe there at the school, so they was like, you should go for it. So I did. Went for the interview, got the job on the spot. was good. I was lucky. So I started dental assisting. I did dental assisting for 3 years. I started with no qualifications, as Tom mentioned. I did all my qualifications through the Port Sydney. I'm so thankful for this program because with this program they cover all costs. They pay for your accommodation, your travel to Sydney. But if I would have went on my own, I would have had to go drive 2-3 hours away from Bogga just to get a qualification out of my own money, you know. So I was really thankful that I come across this program. What else? Yeah, so I worked as a dental assistant for 3 years. Got all my qualifications through the Poche program, and that's pretty much where it all began. I did a few qualifications through the Poche program. This program is so successful. I go around and encourage other young Aboriginal people to come through with this program because the support is amazing. The qualifications, I've done 6 so far. I'm still going. So I've done 6 qualifications through this program. All my dental qualifications, and I've also done like a statement of attainment in community research. I did the research one because I wanted to know how research worked, so that got my foot in the door for that. With my dental technician qualification, I'm able to travel around New South Wales and provide mouthguards to the youth. So I've travelled to Taree, La Perouse, Inverell, Mungandai, Batemans Bay and Wagga Wagga. And this was called a project that we created at the Poet Centre, Guards on the Go. We won a grant and I hit the road. So travelled around and we worked with local AMSs and it was a good program. We had a good turnout. It was really good. Then the denture clinics. So the denture clinics are up in northern New South Wales. So we cover a few communities up there, Bogabilla, my own town, and the surrounding communities as well. So we go in on a Monday, start prepping for the dentures, and we finish on a Thursday. We finish about 12 to 14 units before we leave, all in 1 week. We don't send any work away. We do it there on the spot and deliver when we finish. So there's some pictures. Yes, awards. So hard work does pay off. I've been recognised for the hard work that I've done. Not only that, of being I wouldn't say overachiever, just a good achiever student. So won the R10 Aboriginal Student of the Year in 2016 and the TAFE New South Wales Western Sydney Aboriginal of the Year. Last year I won the National NAIDOC Award, Apprentice of the Year. That was kind of strange to me because I was like saying to one of my work colleagues, "Oh, it's just New South Wales, isn't it?" This was the day before the award. She's like, no, it's Australia. I was like, oh, shit. The nerves started kicking in then. I also won Apprentice of the Year Gilly Award, which is TAFE Awards, standing next to Governor in General. And also I was a finalist for the overall Gilly Award. Didn't get the win, but it was good to be recognised for that. So now I work alongside the Poche program, the scholarship program. We have a range of health scholarships available, not just in dental. And, I've been invited to do guest lectures to other universities. I've been to Newcastle. They have a good little university down there. That's awesome. I've also went into schools and did talks about mouthguards and protecting your teeth and all that stuff. Since doing the dental, or coming through the dental scholarship program, I've been an inspiration to not only other young Aboriginal people, but also my family. 2 of my sisters have come through the program as well, and they've went on to do, well, one of them went on to do another certificate in health services, so she wanted to expand, which is what I inspire people to do. You know, it's not just dental out there, there's other scholarships or health programs that they can take. But I'm always there to support them and mentor them, always on call for them, and yeah. So as I said, I've been working in the research as well, advocating, and yeah. Sorry, I'm just trying to think. What's next? So at the moment I'm completing a diploma in leadership in management. I'm trying to step away from the dental. I want to go into management, so I'm trying to prepare myself to be the director of Part Sydney. That's my goal right now. So, and yeah, I have great people around me, mentoring me, and the support is great. Like I said, it wasn't long, so thank you.
Good on you, Paul. No, well said. Don't step back. Step forward. Yeah. Paul, you mentioned, I saw on there you had fluoride varnish.
Fluoride varnish. Yes.
Yeah. Can you tell us a bit about that and why it's so important?
Fluoride varnish. So that's another project I'm a part of. We go into local schools or schools that have a high priority of Aboriginal Indigenous kids, and we go in to apply the fluoride varnish to, I think it's protect the teeth and from having less risk of getting decay at a younger age. So yeah.
Yeah, and there's been work that Poche has led to try and get a national approach to fluoride varnish, because it is still classed as a poison under the TGA, so you have to be qualified to be able to administer it. So it's most of the dental groups are the state bodies are receptive to the idea, but I think we've still got a few challenges. And
Yeah.
if you want to know any more detail, John Skinner down the front there, Dr. John, he can help you out. But the other thing, Paul, as part of the program, through the volunteer dental program, where we get volunteer dentists as well as Poche dentists going out to communities, what is it, over half a dozen communities now we've done a full dental health check to?
Pretty much, yeah.
Yeah.
Yeah, every community, like, I think it's the denture clinics are getting less and less because we've been there. We go out every month, so we're making a change out there. It's really good.
So if somebody wanted to say they didn't have access to you and they wanted to get dentures, how long does the process take? You know?
About 3 months, 3 to 4 months, like to go through that process from start to finish, whereas we just do it in 4 days.
Yeah, if they could get an appointment, it means they've got to go into Sydney or a major centre to be able to get the dentures fitted and retested and so forth. So
and then every appointment could be like 2 weeks apart or 3 weeks apart, depending on the system they have in place.
So it becomes important, and the mouthguard program is really about educating kids about good, you know, rugby being the sport of choice over there in New South Wales. Getting them trained earlier with mouthguards, and as you saw in the photo, they're all Indigenous mouthguards, so they're very proud of that.
Yes, very proud.
Yeah, so, Nicole. Can you
Don't take a big breath like that. I'm going to be nice. No, I just want to congratulate you on the work you've done, and just to say you are a true leader, because I know and from a very, very small town with lots of barriers, and you have just been amazing to where you've come from today, and I know you've made a lot of people very proud from your town, and as Aboriginal person made me very proud to watch you grow. But also with the work you're doing, and you just said, Tom, about the dentures and that, and looking at even the health and well-being of our people is really important to have teeth, not for just for eating, but for for social emotional well-being.
Yeah.
Also,
Mental
for
health.
for mental health and all those things. So,
yeah.
and like you said, a lot of our people wouldn't be able to afford to go to the city to get teeth. It wouldn't be high on the agenda. So with Poche and you doing this work, you're making big changes to a lot of people.
Yeah.
So well done.
Thank you. Thank you.
And I think part of what you're doing is also a whole lot of oral health education, you and the team
Yes.
out there. So it's about, prevention and utilising, what are those, bamboo toothbrushes?
Yes. Yes.
They only just, the outside's made of bamboo, but yeah.
And the water bubblers have been put in a lot of...
Oh, that was going to be next. No, go on. We can talk about that, yeah.
My name is Jed Fraser. I'm a proud IHA member. I study a Masters of Public Health at QUT and work as a part-time at Quake. Your Delhi brother. And one thing you were talking about is going to schools and communities and talking about opportunities and things like that. You spoke about how you dropped out of school, then decided to come back and do some stuff.
Yeah.
I guess mine's a two-parter. What clicked in your mind that I need to go back and do education, because with IHA and my university and things, we go out to communities and we want to tell students about opportunities and key messages to go into Aboriginal and Torres Strait Islander health. So I guess what sort of made you do it, and what's your key messages when you go to community and talk about health opportunities?
So I always got told by my aunties and uncles, you're smarter than this, you got the brains, so go and do something with it. I just looked at them and I followed friends out of school. I wanted to go out and have fun and whatnot. But then it really ticked in my mind when I turned, say, 20. If I don't have any certificates, where am I going to get? So I was like, I really need to go back to school and make something of myself. And I turned around to my mother, I said, I need to do this. And she was the one who encouraged me to go back. So I was like, yeah. So having people around you like that to support you and to push you, then yeah. Thank you.
Dawn.
Thanks for that, Paul. It's very inspiring. Dawn Bessarab again from Perth, UWA Poche. Mine's a question around, in your work as a dental technician and going out to communities, have you found that or done anything with parents or children around grinding their teeth, particularly in their early formative years? Is that been an issue or not? Because I was just wondering if it has, how you might approach that with families and parents for small children who grind their teeth down while they're sleeping.
So with this qualification, we do make night splints as well. So I guess we just, if they're grinding or something, we do make a mouth splint for them to sleep at night, so that it stops them and prevent them from grinding their teeth. Working up in the communities that I work in, not really. Maybe 1 out of 50. So, yeah.
Nicole did ask the question about water, which is a real big issue around remote Australia at the moment. In the Northern Territory, communities are running out of water, as well as in New South Wales and some parts of Queensland. But the issue that was started off with Poche was really that a lot of people were not drinking the tap water because it was pretty foul, and so they were buying soft drinks, which of course is so corrosive on the teeth. And so there was a big program about chilled water. Do you know anything about that? Little bit?
a little bit. So what happened is Poche did an initiative to implant these water fountains up in community. Where I'm from, Bogabilla, the water was more expensive than the soft drink. That's why everyone would buy soft drinks. So you couldn't drink the water because it was too hot, and parts of it there was bore water. They done a good initiative and implanted these water fountains up in Bogabilla and Termalo and some other communities as well. And Manganai, and it's refrigerated fountain, so the water's always cold. But yeah.
Yeah, thanks. And a lot of these initiatives, even the scholarship program, isn't totally out of Poche. We're the ones that facilitate and get other parties to come in, like the state government, to work with us. And you know, as I've mentioned earlier, that you know, part of what Poche is about systemic change, trying to influence other parties to take up their responsibility to be able to get good health outcomes. We're not about trying to deliver a health service, although we do with oral health, but it's only because oral health is one of the most neglected areas in health, you know, across all jurisdictions. And what we've been able to demonstrate to the New South Wales government, who has come good with a lot of support, is that we can do it for a quarter of the price and twice as fast as they can do it with their dentist. And because of the way that we approach the engagement with the local Aboriginal health services, and it becomes a partnership model. So at the same time as you know, going out there and doing oral health work, we're also empowering the I think there's about 19 or 20 AMSs that we partner with in New South Wales, for them to understand the value of oral health and train them up to be able to deliver oral health messages, including, you know, one of the big ones that we don't talk enough about is the impacts of tobacco on teeth, and either as chewing or smoking, and you know, the gum diseases that go with it. So it's all part of an education process.
Yeah, and I just wanted to go back to your question earlier. What I do with young people of today is I give them my number and I let them know that I'm there for them. So for that support, yeah.
Okay. Any other questions? Well, Paul, very proud of you, brother.
Cheers.
Thank you.